Hi, everyone. This is Jackie Cooper with the talk show for the Government Blockchain Association, as well as the Blockchain Legal Institute. We'd like to welcome you to this episode. It actually is a continuing episode, and I'm very excited to be speaking to the CEO of Solve.Care to talk about what has happened since the original conversation, because there's a lot of developments that have happened over the course of time. I also would like to ask that everyone who's listening definitely like and subscribe to the GBA YouTube, so that way you can stay in contact with what the GBA is doing. I know that for those that are not familiar with the GBA, it is a global organization, and the GBA has both virtual events as well as in-person events. And depending upon when you listen to this conversation, there could be an in-person event happening in the spring in May, or in September, the fall. So definitely check the link below, which will be in the blog below, so that way you can also become a member of the GBA, as well as to participate both in its virtual events as well as its in-person events. So today we have an update on Solve.Care. How are you doing today, Pradeep?
I'm great, thank you, Jackie. It's a pleasure to be back
Yeah,
and
I'm
dialing
excited to
these.
have you as well. So many individuals who are just stepping into the YouTube or the audio side might not know anything about your background or Solve.Care. So would you like to kind of give an overview as to why you felt it was important to step into this space and to create Solve.Care?
So my background is healthcare for the last 30 years. I worked in insurance and in public health programs, and I've been implementing large-scale IT systems, enterprise systems on which a lot of the US healthcare runs. And over the years, I've also looked at and been participating in healthcare infrastructure and applications for China and India and other countries. And what I noticed in the role of a decision maker and as a buyer of technology in healthcare, that there are a lot of the same mistakes repeated year after year, leading to a lot of waste, duplication, inefficiency, and really increasing healthcare costs and continued disenfranchisement of the patient. We talk a lot about patient-centric care, but none of the IT infrastructure that exists anywhere in the world is really patient-centric. It's all enterprise-centric. And as a result, while we all can talk about value-based care, performance-based payments, accountable care, patient-centric care, patient-centered medical home, all these initiatives, they ultimately struggle or die at the altar of wrong tech stack, the wrong approach. So you can't really build a building on the wrong foundation, expect it to stand for long. So that's the problem in healthcare, and it's a universal issue. So I started to ask the question, 30 years in and having overseen billions of dollars in expenditure, as to when will we actually do things differently? And looking at the large enterprise application stacks, be it Oracle or Salesforce or Epic, Cerner, McKesson, Athena, Allscripts, all of these are essentially designed to serve the enterprise through enormous amount of control and aggregation over data and opaque logic. And in that model, every other party has a valid distrust of the system. So we continue to perpetuate this broken model over and over and over again, myself included. And it has real ramifications for human beings. This is not an esoteric problem. So for me, the turning point came when my son was born. He's 10 now. When he was about 18 months old, we encountered significant health issues with him. And I started to face the inefficiencies and the inhumanity of healthcare system myself. And I began to realize that with my Rolodex, with my extensive ability to look around the corners in healthcare, I still was really struggling as a parent to get him the right care at the right time. And it's really hard. So then I started to wonder, when will we change this? And I said to myself, be the change in the world you expect to see. So I left my corporate world and started Solve.Care as a Web3 patient-centric stack on which you can both implement enterprise solutions, but you can also build consumer-centric marketplaces where they can have better choice and access to services, opinions, products, and so on. And in doing so, they should not have to sacrifice their privacy or their identity. So Web3, blockchain, those principles resonated with me fundamentally in the context of restoring rights and humanity to patients in their experience in the healthcare system. And that's how Solve.Care started, and the rest, as they say, is history.
I love it. I love it. So, since our last interview, you've traveled the world and self-care has evolved and developed different things. What has changed or what update has happened since the last time that we've spoken? Over the last, I think it's been about 6 months since we talked
Yeah.
last.
Well, 6 months in this day and age is a lifetime.
It is.
So I will sort of break up my answer into three buckets so you can understand. The first is on the tech side, how we have advanced the technology to make it even more powerful and more patient-centric, and also capable of dealing with any enterprise needs that are out there. The second part of it is about the solutions that have been built on our tech by clients and by us that are really bringing more value, more choice, more rights to the patient and their families. And the third part of it is what we see as key partnerships and initiatives that we are doing and will continue to do, including the GBA, where we are bringing our product and our platform and our solutions to a whole host of markets. So in that context, I'll cover each of these 3 points as a sort of a complete update. So in terms of the technology stack, we have, since we last talked, really brought the platform forward to make it possible for clients and community to author their own networks, their own solutions. Now, everything you do on a platform is referred to as a network because healthcare itself is a networking problem. You're not just dealing with me coming to you, buying something and going home. Healthcare is a multi-party game. You need to have coordination between patient, doctor, pharmacist, lab technicians, nurses, specialists, family members, and case workers, social workers. Depending upon your situation and where you live and what program you're in, you're going to have a whole host of parties you need to talk to and manage and coordinate with. That's healthcare. So we call these things networks. So we have made it easier to write healthcare networks that are very powerful. We've introduced a lot of capability into the platform, which makes it possible to author a network within weeks. And to put things in context, when I was in my previous role as an insurance CIO, or when I was involved with Medicare systems or Medicaid implementation, big public health programs in the US, we typically planned out projects between 18 months and 5 years to do what you can do on Solve.Care in maybe 3 months. So we have really shrunk the level of effort and time and risk and budget that you have to allocate to building a powerful health network on our platform. So I think the acceleration of the authoring process is a big thing for us. And it delivers tangible value to the client because, you might, previously if somebody walked into my office in my previous role and said they're going to build let's say a new diabetes care management solution or a pregnancy management solution or a premature birth, postmortem issues, we would allocate $3 million to 3 years to launch a program like that. You could not do that on the Solve.Care platform for a few $100,000 in literally 10 weeks. And you could do it yourself. So that's the big shift there. The other thing that we have done in the platform is to really, we have brought in some more power into it in terms of support for new devices. And we think of AI as a device. AI is an engine, it's a device. So you can access all kinds of third-party engines through the care platform to write more powerful networks, be it machine learning, be it AI, and many other things. Or you can connect to physical devices like LiveCore or LiveMetric and so on. But the point is the platform is much more powerful to serve more complex needs of more complex population. So that's on the tech side. On the solution side, we have launched some networks. Again, networks being the solution you build on the platform. And if you're an insurance company or you're a hospital, you're a you are a pharmacy or a network of physicians, or you are a government agency, or you're just a concerned citizen who wants to bring better care to your community, you can author care networks on our platform. And many care networks have been authored and launched in different parts of the world. And one of the most exciting networks that we have launched is the clinical trial system. It's called Care.Trials. And this system allows patients, you and I, worldwide, to download the wallet, to join the network for free. And you can then instantly see clinical research happening around you. And you can express interest in that research. And you can do all that anonymously. And that interest gets communicated through the chain to the nearest site where that research is happening. Let's say if you live in Washington, D.C., like I was 5 days ago, you would see that there's a research happening at George Washington University Center, 1.5 miles from you, related to something that you might find very interesting. Most people don't know what kind of clinical research is happening around them, but they certainly know people who can benefit: your parents, your friends, your colleagues. So Care Trials lets you or them quickly find and connect with research that's happening near you anonymously. None of your identifiers are ever shared with the other side in terms of identity, phone number, email. They cannot call and spam you, but they can share with you more information about the research. They can ask you questions, which allows them to determine if you are even eligible for this research. You can refer the research to your friends, and so on and so forth. And in all this, patient maintains their privacy and control over their data. And one of the big problems in clinical research industry is that it's very much a unwanted solicitation-driven model. Today, research organizations are basically mining patient data without their permission, then soliciting them through email and text messages or mail. And you can't really tell the difference between a legitimate research solicitation and scam and identity theft. It's really, really hard for a patient to figure that out. So most people don't respond to even legitimate requests, right? So in our world, we never solicit. We don't allow the patient to be solicited. It's like Bumble for dating. You initiate contact, and then the other party can respond, but they can't just hit you up with an interest. So same idea here. Blockchain protects the patient, controls the patient data. The patient can share or unshare data and all those things that our platform lets you do. So this is really very meaningful, because this kind of a research tool in your hands lets you identify care options that you would otherwise never know about. And I personally experienced this when I was dealing with my mother's health the last 3 months. And it was a really useful tool for me to figure out what better options she might have to the surgery that everybody was recommending. But I was not confident that that is the best course for her, given her age. And I used Care Trials to figure out better care model for her. And thank God for that. Instead of being in bed for a year with open back surgery, she's up and running in 3 days. That wouldn't have happened without the benefit of Care Trials. So we're very proud of this solution. We've launched it in multiple countries, and it's expanding rapidly. One of the reasons I'm here in Korea is to expand Care Trials here. So that's the network side. There are many other networks coming. One really exciting network that we are looking to launch is the early detection of autism in children through using AI. And my son, as I mentioned, when he was born, we felt that he had some developmental issues. It turned out that he is on the spectrum. And it was only because of my wife's acute observation that we felt that something was off, and we took him to early intervention. And even that was very hard to get done. But fortunately, by 2 years old, we had him in intensive therapy. And now you see the kid, and you would never know. You would never know that he started off with such a huge handicap. You would never know. But the only reason we could pull that off is because we intervened very early in aggressive treatment, not treatment, but therapy, play therapy, communication therapy, occupational therapy, how to hold the pencil, how to write. Those things are not easy for kids on the spectrum. They struggle. And we all know that if the diagnosis is even 18 months late, the probability of that child living a normal life goes down to less than 50%. And if you diagnose a kid instead of at 2 years, at 5 years, the probability of them having a normal life is down to 10%, 15%. So, your child's life depends upon early detection, but most people are psychologically afraid to confront that issue and embarrassed. There's a lot of stigma. There's a lot of cost. There's a lot of bureaucracy and issues. There is a lot of weight. So how do you deal with something that is so urgent when the system isn't designed to deal with it urgently? So you use AI. So you use AI to build tools where child's normal behavior can be analyzed to see if there's a risk. Now, it's not a diagnostic tool, it's a risk assessment tool, but you can do it anonymously. You don't need to disclose your identity, your phone number, your email, your location, your child's name, your name. So if you can use a tool in a completely anonymous, secure, safe way and get a risk profile done, I think that will save millions of children from an agonizing life later on, right? So we are launching this network here in Korea, and I'm here to work with talking to the regulators and discussing how to work with them. We've been admitted into a sandbox, into an innovation center, which allows us to have exemptions from all the laws that prevent these kind of innovative solutions from being launched in the market. And we hope to launch this solution here in Korea in the coming 60 days, if we move quickly enough. So, really impactful, because what's the point of having all this tech and blockchain and Web3 if you're not going to impact human quality of life, if you're not going to give our kids a better place to live, and if you're not going to make it sustainable and economically viable? So we are trying to do things that have very profound impact on human beings. Care Trials is one example. The Autism Detection Network is another example. These are the type of networks that we are launching in different parts of the world. And coming to my third answer on what we're doing in terms of partnerships, we are very encouraged by the type of clients and partners who want to embed their services into the platform and want to use our platform to bring more solutions to market. So we've just recently signed a major partnership with an organization in Philippines called the Philippines Alliance of Patient Organizations. Now, what that organization does, it represents the interest of about 4 million Filipinos who have some kind of chronic disease, kidney disease or hypertension or either diabetes, cancer, asthma, COPD, whatever. And these patients are looking for more guided care. They're looking for more information about how to take care of these conditions for themselves or their family. So they're very engaged patients. And what we are doing with Papo is working with them to give these patients AI-based advocacy tools where they can ask questions about their disease condition. They can ask questions about what kind of advanced care trials are around them and give these people choices that they previously would not have. And the advocacy groups love it because we are basically helping them do their job. And most importantly, we don't collect or mine patient data, which they absolutely hate. That when anybody does that to their patient groups, and we don't, because we are a Web3 platform, and the patient has their own data. Solve.Care never knows the identity of the wallet holder. We never ask or collect the identifiable information. So we don't know who is the wallet holder. So it's a zero knowledge system where the patient's role in the network is known, but their identity is not. So that gives people a lot of comfort that nobody's going to solicit them or send them emails or show up at their doorstep, trying to sell them insurance, something like this. None of that is possible in the platform. So therefore, patient advocacy groups love us because we are truly patient-centric. And they have never seen tech like ours. All Web2 tech ultimately relies upon blind trust. And our tech, you don't have to trust us, trust the tech. So therefore, it's a very, very compelling. We're also looking at some very unique distribution partners in Asia, retail and other partnerships, where we can promote Care Wallet to average consumer. And I'm really excited because through our distribution channels that we have, which are uniquely powerful, but also very unique and difficult to build, we think we will have about a 10 million patient population using Care Wallet over the next coming couple of years, giving us an enormous platform to launch more innovation. Because whatever network you launch on a platform with a click, 10 million people will see it instantly. You don't need to download your wallet. You don't need to upgrade your app, nothing. The network just appears in your wallet. So imagine the power of being able to innovate on diabetes or cancer or whatever, and know that when you publish that network on the Care platform, instantly 10 million people in 20 countries will see your network and can start using it overnight. It kind of becomes the marketplace that everybody dreams about, but nobody has. So that is our ultimate goal, is to grow our wallet count to a number where we become the de facto healthcare innovation framework for everybody on the planet to launch innovative solutions. And you can do that in weeks because we made the authoring process so easy. So I think overall, we have these three factors coming together: the network, the platform, maturity, the quality of networks being built on a platform being very poignant and very relevant to people and parents and human beings. And then the partnerships for distribution, which makes it possible for your innovation to get to millions of people with a click. I think we have a really exciting future ahead of us.
Yeah, no, a lot of updates. I don't know if you remember, but my background besides being law is I'm in special education. So I definitely appreciate everything that you're sharing about the process and about helping others, especially the children, especially early on with early intervention and support. Because I agree, when you are providing the services, the therapies and other intervention supports, the body has the ability to adapt, but also it's important to always be an early adopter for all this type of support. So for sure, I do have some questions. I know you've mentioned both the Care platform and the Care trials and the Care Wallet. So the Care Wallet, is it easy for everyone to access, or what's your vision for that? Because there are many people who are maybe not tech savvy, but need to be part of this system. So how are you addressing that?
Absolutely. I mean, that's going to be a key benchmark to global adoption of Care platform. Because no matter where you live and no matter what disease condition you are worried about for yourself or your family or your loved ones, you need to be able to download the wallet and connect to the right network.
Right.
So the fundamental, factor here is that you have a wallet on your phone, and we call it wallet for life. Because when you're young and healthy, you might join the exercise network, and when you're a little bit older, you might join weight management network. And when you are a little bit older, you might have some pre-chronic conditions. You want to manage them through a pre-chronic treatment network, and so on and so on. All the way till end of life, you will use the right networks. But the wallet is the same in your hand forever. And it also gives you a lifelong ledger of your health. So that's the premise. And it's also the place where all the networks appear when new networks are launched. So net wallet has to be simple. And crypto wallets are not easy to use. You have these keys and you have these mnemonic phrases, and it's just not human ready. It's more enthusiast ready. So we have been working hard to improve the wallet in terms of making it less crypto and more grandma ready. And our internal mantra is make it grandma friendly.
Yeah.
And we have taken strides towards that. Every click matters. Every extra step is essential. And I think that we made a lot of steps in fact, earlier today, we released version 14 of the Care Wallet. We call it R14. It just came out about 2 hours ago and is in the App Store and in Google Play. Today is May 25th, and we launched it just a few hours ago. And R15 will come out in about 3 weeks with even more simplification. But you really have to think about everything. So we launched the Care R13 in Philippines, and we had a lot of events where we met with patients. And one of the things we realized is that patients don't like SMS text messaging anymore, that they don't want to get your passcode or the PIN code through SMS. So very quickly we went in and we introduced email and WhatsApp as a mechanism to get the SMS, because many people especially in Asia and other places, SMS cost money, data is cheap.
Exactly.
So you don't want to send them an SMS if you can avoid it. So WhatsApp is data driven, and therefore there is not that much of a cost involved, or email. Then we just heard yesterday from another country that they don't like WhatsApp in that country. They prefer Viber by and large. So in about a week's time, we're going to introduce Viber login through the wallet. Other people in other parts of the country saying, we want to really log in through Alipay login. We want to log in through Binance login. We want to log in through Google. So we are continuously enhancing it to simplify even as simple a step as how do you log in?
Yeah.
And of course, not everybody has Face ID. So Face ID support, Touch ID support. These are all things you got to keep doing, keep enhancing. Most people don't want to deal with a mnemonic phrase. So in the upcoming release, we will shard the mnemonic phrase and store it in different places and reassemble it should you need it. So you don't have to worry about storing your mnemonic phrase yourself, because most people won't do it, right? We spent a lot of time earlier this last month in figuring out if you join 5 networks, how do you switch between them?
Yes.
So it's just, how do you know which network you're in? How do you switch between them? So we introduced swiping, and we introduced, tap and hold and all kinds of things. I would say that in the big scheme of things, we are halfway there. I think we have, probably 3 more releases to go based on feedback. But as we have millions of people starting to use the wallet, you get a lot of diverse feedback.
Yes, you
And
do.
that makes it easier to do the product. But when you have, a product being used by 100,000 people, it's one thing. When you have a product being used by 1 million people, it's another thing. When you have a product in the hands of 10 million people, it's a whole different thing. And it's not just 10x, it's 100x more, sophistication you need in the product. It's not linear, it's asymmetric, it's algorithmic. So we are getting a lot of feedback from the market as to little things we can do to make the wallet easier to use. And we have a big team just focused on making the wallet easier to use. Then you get into localization. Then you get into, colorblind. You get into people who have only left hand or right hand movement.
I
You get into
was thinking about a whole slew of areas that you're probably thinking about addressing just because of the diversity of
right.
both the mental cognitive state as well as the physical state.
Yeah. One of the tests we are doing right now is we are looking at, what if you are one-handed? Can you use the wallet with one hand? With the wallet, in your hand, your phone. And of course, many form factor is too big these days. So you can't really use, your thumb to get across the whole screen. So how do we, make buttons big enough? How do we allow people to set their configuration if they're left-handed or right-handed? There's a million things, but we are committed to that because we know that eventually Care Wallet becomes sort of like your Amazon for healthcare.
Yeah.
If you go to buy every healthcare product, service, or opinion you need, is where you go to coordinate your care with your friends and family. It's where you create your circle of care. It's where you create, where you have your care vault, where you have your care ledger. So if and we know that millions and millions of consumers will come through the channels we have signed. So we really believe that we are the Web3 blockchain utility that will bring millions of consumers to the Web3 blockchain space, because we already see it happening. So Wallet has to live up to that expectation.
Yeah. No,
So is
it
this
does.
journey going to ever end? No, it's never going to end. It's going to keep going. But we made strides towards making it grandma friendly, and a lot more is coming.
This is very exciting. So you have mentioned partnerships. Are there any specific partnerships or new partnerships that Solve.Care has formed that you want to talk about? Because we've talked about a lot of different things.
Well, so I mentioned Papo in Philippines, which is a 4 million patient population group.
Mhm.
We are working on some very large partnerships, which we haven't received their permission to announce. One of them represents close to 60 million consumers. We're very keen to announce that when it's fully baked and ready to go. We're looking at a partnership where, the objective is to make Care Wallet ubiquitous.
Yeah.
So, we were recently discussing, although I won't name the name of the company, where Care Wallet would be available in every airport in America, where you would see, Care Wallet essentially incentives to download and use the wallet and have some immediate benefits between before you get on the plane. So things like, how to stay healthy on the plane, how to take care of yourself and hydrate, whatever, lots of things. So, and in partnership with people who sell products that can help you on flight. So lots of very interesting partnerships that are coming, but the objective is very single-minded objective. Let's bring consumers to Web3 and blockchain through the wallet by the tens of millions, by giving them usable solutions that they can use immediately, that are relevant to their health and well-being, and that are easy to use through the wallet, and enable all kinds of healthcare innovation to happen on the Care platform in the form of new networks, and having this massive distribution capability with one click
Yeah.
by able to publish. If you could build a network, let's say for Chinese speaking population, and deploy it with one click and say every Care wallet which has this language set to Chinese will automatically see a notification saying that we have a new network, which gives you some new feature functionality. Instant distribution, right? There's a lot of tech in the world that gets built and nobody uses it. And my view over the years has been, for the decades, is tech isn't the problem, distribution is the problem.
Always.
Great tech is going to die if there's no distribution to the end user. Now, you can do that through social media, you can do that through hype machinery, whatever, but it's not effective in healthcare. Those things don't really work. People don't buy health products based on social media. They don't buy it based on hype machine. They do not buy from solicitations. Healthcare isn't sold through the normal, mechanism of selling a sweater or selling a car. It doesn't work like that. So you need a trust channel through which you can distribute health products. And that's what we are building.
So healthcare is heavily regulated. Blockchain Legal Institute talks about compliance and the changing legal community. How are you dealing with compliance, especially since you are global? And again, how are you working in those various areas?
Compliance has been, I have grown up in the compliance space. I am a big, I would say student, not a fan necessarily, a student of compliance. And as a former exec, it was my job to be compliant and enforce compliance within my organizations, within my public health systems and whatnot. So, compliance is there to protect the parties, typically the one that has asymmetric disadvantages. So you want to protect the hospital, you want to protect the patient from having their data being monetized or exploited in a way that's not appropriate. You want to protect the patient from being given substandard care. So it's always about whoever has asymmetry of power or knowledge or information should be protected. That's what regulation is all about. Now, regulation in healthcare is very regional. You cannot say there's some blanket way to do it. So what we have done in the wallet is, because wallet is a global channel for distribution of health solutions, the only question we ever need to know about the wallet is which country are you resident in? And based on that, the right compliance fabric kicks in. The wallet alters its behavior to the underlying compliance contracts on the chain. So different countries have different compliance rules, and then based on your attestation as to where you are resident, the wallet will configure itself to compliance in your area. If you're in a country, if your wallet is, you say that you live in Saudi Arabia, for example, then we know that the data, all your data that is in your wallet, if it has to be backed up, it must be backed up to servers in Saudi Arabia. It cannot go outside.
Right.
Your wallet travel with you. You can go anywhere. You're a human being. You can get on a plane and fly to London, and your wallet and your data will go with you. But the digital avatar, the proxy for your wallet, which is your backup or your node, cannot leave Saudi. So that would be an example of compliance. We can, and then the network itself, where you actually buy services or products or opinions, has to pass compliance for wherever they are being launched. So the platform enforces compliance at a macro level by enforcing compliance by country, and the network enforces compliance by the cohort, the population that they are serving. So between the two of them, we can address any compliance matrix. And I would submit to you that I have worked with all the major tech stack in the world, Oracle and IBM, PeopleSoft, Watson, Salesforce. I was a client for all of these tech stacks. And none of them are really built for compliance. In fact, they presume that it's your God-given right to aggregate data. It's your God-given right to have completely opaque logic that nobody knows what you're doing with the data, how you're managing, manipulating, analyzing it, and everybody should just trust you because you have a big logo and a big building. And that's how tech is built, which is why compliance is so hard. First, you allow all kinds of misbehavior and inappropriate transfer of power and data to the hands of one party. And then you try to regulate that party to make sure they don't do bad things, while giving them every financial incentive in the world to do bad things.
Yes.
So how do you think compliance is going to ever work when you first enable the sin, and then you come back and try to punish the sin if you are caught? So most of the compliance models are written to first permit abuse and then try to manage and minimize the abuse. In our platform, you can't do it. It fundamentally doesn't allow you to aggregate data without consent. And even if you do aggregate data, it tracks its usage. And if you misuse it, you can unshare the data, which is something that's not possible in the traditional tech. So those kind of things make compliance a lot easier. So I like to say to my team, HIPAA, which is a well-known, framework for data protection and patient privacy, was supposed to empower the patient. All it did was empower the physician and the institutions to have absolute control over your data, because they ask you to waive all your HIPAA rights day one, and then you're done. They own everything after that. We implement the spirit of HIPAA, where patient never gives up control over their data, even through sharing with the doctor. That's what HIPAA was really trying to achieve.
Yeah.
Except, as most laws are written, it's been subverted to do exactly the opposite of what it tried to do today. And we bring that humanity back. So in many ways, I think in every way possible, we make regulation work the way it was intended. And I think in that we stand alone. There's no tech stack that I know of, no company that is committed itself to compliance more than we have.
So, thank you for sharing that. Self-Care's main goals and priorities for the next year. I know that we see each other at the GBA events and also in other circles, but if we were to talk in 6 months' time or a year from now, where do you see Self-Care going? What's your vision?
So I think the three key metrics: one is the number of wallets that we expect to have downloaded in the hands of an average consumer would be an order of a magnitude higher than it is today because of all the partnerships we have signed. The second is the number of networks that serve the patient and various health needs, be it autism detection, be it clinical trial participation, be it other health conditions. They are coming fast and furious. So you will have a lot more choices in 6 months' time. And the third and most importantly is, I think that I want to measure us on, is how autonomous can you be in launching new networks? Ideally, you won't talk to us at all. Later next week, this is sort of breaking news kind of a thing, we'll be publishing an entire protocol on Gitbook and that will give you the ability to do everything we can do. All the magic that we have created, care trials and all these amazing networks that we have authored for clients, you can do them yourself. And we will publish the source code for networks, and we're publishing the full Gitbook. So that is a huge step for us. So Gitbook goes live, I'm not exactly sure it's going to be Tuesday, Wednesday, Thursday, but sometime in the span of next week, we will put out our entire protocol and its authoring power on Gitbook and out there. And that, I think, is the biggest thing we can do, is to empower innovation and creativity and problem solving without having to incur massive costs that today is taken for granted. And I'm hoping that, people who are in my chair from, CIOs of insurance companies or program administrators of Medicare or equivalent organizations around the world, you have a new tool that lets you solve problems that typically come with 7 zeros attached to it. You can maybe get rid of 2 zeros, any 2 zeros you like. because it's just that much better technology, that much faster implementation, and it's not, it's incremental. You can launch one journey and then expand to 20 journeys. But you can do that, a journey a week and build a complete hospital management system in the span of a year. And some of these systems cost $1 billion today to run. So that kind of power is what we are unleashing in the world. And I think more people who learn about it, more organizations using it, that would be the metric I would watch most carefully over the next 6 months.
So uh, I have one other question, but before I get to that, you've talked about a lot of industrial countries that you're working with. What about countries that are in the third world, who might not be as developed? How are you helping or reaching them so they can also benefit as well?
Well, I mean, many of the countries we are in today are definitely in the developing or underdeveloped, no doubt. So when you look at, and I think it depends on how you define it, but
True.
Asia is a big focus for our networks right now. The platform is really agnostic to where you deploy a network, but networks that we have recently launched are in Asia, and those networks are serving a huge mass of humanity. Many of them are below poverty line. They have limited resources, limited literacy rate, and so on. So we are already there. But ultimately, our goal is that we cannot be the innovator. We cannot be the ones deciding what health programs, are worthy of or appropriate for, let's say, Myanmar.
Yeah.
It's a Myanmar doctors or nurses or pharmacists or lab owners and operators are the ones who need to launch networks there. So in that sense, we don't really see a huge difference between a developed and a developing country
Interesting.
because innovation is happening. Innovators are everywhere. And in fact, more greater the need, the more, more innovative people become to solve them. So as a result, we are making a platform available to everyone. And we are seeing great innovation come out of all parts of the world, developed and developing. But on the networks that we are ourselves authoring and launching in the market, those networks are already, global. Like Care Trials is, I think, currently available in 80 countries. Majority of them are developing nations.
Wow.
So I think that from our side, we don't have a particular emphasis on developing versus developed. By definition, where the need is greater and networks grow faster are the developing nations.
So any last minute thoughts that you'd like to share before we sign off? Because there's been some remarkable, developments that you've shared for the last 6 months, but anything else that you would like to share?
Well, first of all, thank you for having me here, and both to the BLI as well as GBA. There's great work being done in Washington by folks such as yourself and Gerard and others to really bring awareness of what the tech is capable of doing in terms of delivering value to society.
Exactly.
I think these organizations such as GBA and BLI have helped disassociate blockchain from crypto, right? Because in the first 5-6 years, every time you uttered the word blockchain, people said, oh, this is Bitcoin and some scam and this and that. That conversation is largely finished, right? For the most part, CIOs, CTOs, program managers, even consumers are starting to think of it as a tech that can be helpful and useful, not some kind of a representation of a lawless world, which is where it stood for a long time. And we knew that day will come, but it has taken a while. And a lot of that is in thanks to organizations like the GBA. So I wanted to thank everybody back home who's listening that the work you're doing is having an impact. The second thing that I will say is that if you are, an innovator in healthcare, in blockchain, whether you are playing with layer 1 or layer 2 or writing smart contracts or staking, farming, all those things, those are all great use cases. But the real use case that I challenge you to focus on is actually applications that consumers can use. And Care Platform is the bridge between the chain and the consumer. So I will say to everyone listening, chain is not enough. blockchains aren't consumer-friendly, enterprise-friendly tech. It's a technology that is, we can call it deep tech, and it is useful only when you make it usable by the enterprise or by the consumer. And there's a big gap between fast chain with low gas fee and usable applications that an enterprise can launch in a compliant manner and actually get value to business and to consumer. That's a big gap. And that's what Solve.Care has solved. We are the stack that bridges the chain, if you think of that as a bottom of the cake. And if you think of the top of the cake being the wallet through which you experience health care and wellness, and everything in between is the stack. So we like to call ourselves a Web3 version of Salesforce.com because we believe that they have done a really good job and we can do a better job in bringing enterprise and consumer capability, which uses the chain, but isn't really obsessed with the chain itself. The chain needs to do its job. It needs to be fast, cheap, and immutable. But beyond that, that's not enough tech to give enterprise or consumer an exciting solution. That's the gap we have bridged. And very few companies have taken the time to do it. It's taken us 7 years to do it, but now we are at a point where there isn't a healthcare problem that we can meaningfully address. And now the chain adoption is automatic because inherent to every network is a chain, but inherent to every car is an engine. Well, you don't particularly worry about the engine. You just buy the car you need. Same with the blockchain. Chains are not enough. Care platform makes the chain useful and usable. And so come join and build something useful for your community.
Yeah, no, I'm very appreciative of what you just shared. And for everyone who's listening, there will be contact information in the blog below. And if you have questions, reach out. That's, the beauty of our community. We're always open to answering as well as to look at what's needed next. And that's exactly what you did. You saw what was needed and you innovated and are creating the solution that is definitely making a change in the world today. So for everyone who's listening, as I always say at the end of all my recordings, be kind to yourself, be kind to others. We're so interconnected and now even more than before. So have a great day and we will talk to you soon. Bye, everyone.